The gentleman yields. The chair now recognizes the ranking member of the committee, Mr. Pallone.
Thank you, Mr. Chairman. Before we move to my questions, I just wanted to again say that this hearing is incomplete without testimony from Secretary Kennedy. I don't think we can address this threat without hearing directly from the HHS Secretary. So pursuant to Clause 2K6 of House Rule 11, I move that the Committee on Energy and Commerce issue a subpoena to HHS Secretary Robert F. Kennedy, Jr. to testify before the committee.
Mr. Chairman, I move to table that motion.
The motion is not debatable. There has been a motion to table the motion for the subpoena. All those in favor of tabling,
Roll call vote,
Mr. Chairman, I'd ask for a roll call.
the gentleman asks for a roll call vote, and the clerk will record the call.
Mr. Balderson. Mr. Balderson votes aye. Mr. Palmer. Mr. Palmer votes aye. Mr. Crenshaw. Mr. Crenshaw votes aye. Mr. Weber. Mr. Weber votes aye. Mr. Allen. Mr. Allen votes aye. Mr. Fulcher. Mr. Fulcher votes aye. Mrs. Harshbarger. Mrs. Harshbarger votes aye. Mr. Ruley. Mr. Ruley votes aye. Mr. Guthrie. Mr. Guthrie votes aye. Ms. Clark. Ms. Clark votes no. Ms. Deget. Ms. Deget votes no. Mr. Tonko. Mr. Tonko votes no. Mr. Han. Mr. Han votes no. Ms. Fletcher. Ms. Fletcher votes no. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes no. Mr. Mullen. Mr. Mullen votes no. Mr. Pallone. Mr. Pallone votes no. Chairman Joyce. Chairman Joyce votes aye.
The clerk will report the tally.
Mr. Chairman, on that vote, there were 10 ayes and 8 noes.
The ayes have it, and the motion to table is agreed to. The committee will now resume the hearing. Mr. Pallone is recognized for his 5 minutes of questioning.
Thank you. First, Dr. Havers, I want to thank you for your years of service at the CDC and your work as a physician on the front lines of multiple disease outbreaks and pandemics. I am incredibly concerned that the Trump administration is putting the health of Americans at risk by cutting health care coverage, refusing to practice real science, and spreading misinformation and disinformation, particularly about vaccines. So let me ask you, Dr. Havers, is the country at risk of diseases that we had beaten back, measles, polio, chickenpox, coming back again due to the actions of this administration?
Absolutely. We're already seeing this happening.
And as you explained in your testimony, you resigned from the CDC in protest of Secretary Kennedy firing all the members of the Advisory Committee on Immunization Practices, or ACIP. So, Dr. Havers, what impact do the decisions of ACIP have on our country's ability to prevent or respond to public health threats? And what do you think the consequences of the current ACIP's decisions will be on the country's health?
So historically, this committee was very important that there was one immunization schedule for the United States. There were transparent processes where all liaison organizations, for example, the American Academy of Pediatrics or the American College of Physicians, would weigh in, give scientific input. There was a rigorous scientific evidence-based process that occurred before any vote. So this vaccine schedule was trusted universally by clinicians. What we're seeing happening now with a firing of ACIP and the replacement by an ideologically driven committee is that we're seeing not only critical recommendations being taken away, but we're also seeing clinicians being confused, state and local health departments and organizations are coming up with their own vaccine schedules. And this has done incredible damage to CDC's reputation. Trusted partners are now saying we cannot trust CDC because of what this committee has done. Furthermore, doing things like removing the universal hepatitis B birth dose recommendation, which has been in place for more than 30 years and was credited with basically eliminating pediatric hepatitis B in infants and children in the United States. They voted to remove that recommendation. That is going to cost children lives. Like that will kill, we're going to see preventable deaths occurring. So not only has this administration taken a sledgehammer to CDC's credibility, but they are making decisions that are going to lead directly to an increase in vaccine preventable deaths, while making it much harder for frontline healthcare workers, such as pediatricians, to have conversations about what vaccines should be recommended, why they're recommending something that CDC no longer recommends, because they are doing what is based on science, what is based on evidence, and CDC is no longer issuing recommendations that are based on science.
Well, during the first Trump administration, Operation Warp Speed brought together government, research institutions, and drug manufacturers to quickly develop, manufacture, and deploy COVID-19 vaccines. It was a huge achievement, and I'm worried that if we tried the same thing today, we would not have willing partners in industry and appropriately resourced research and public health workforce, or a public even willing to take whatever treatment or vaccine is developed. So, Dr. Havers, if we suddenly found ourselves dealing with a new pandemic threat, whether man-made or from nature, are we better off or worse off than we were before COVID-19 because of the actions of the Trump administration?
We are unquestionably worse off.
And if there were a lot of hard-earned lessons from COVID-19, I mean, I think that we all saw, it seems like the Trump administration is hell-bent on ignoring the lessons from COVID-19 and erasing any progress in science and public health. So my last question is, what are the top things that you think the government should be doing to keep Americans healthy and safety that the Trump administration is not currently doing?
Well, this administration needs to move back to policies that are driven by science and not ideology. It needs to invest in public health infrastructure, strengthen local, state and local health departments, as well as CDC, and stop attacking experts for science, for making decisions based on science. I think we are definitely, I mean, there are also, as we're hearing, we need to invest heavily in science, not cut NIH grants that could lead to novel innovations that could protect us in the next pandemic. FDA needs to be returned to having a standard regulatory process so that industry and other partners will see the United States as an environment where they can develop novel therapies and then have a sort of a standard process that if they meet certain benchmarks, they know it can get approved. I think having an ideologically driven HHS leaderships means that whole environment has been upended. I think we're losing scientists to go abroad. I think innovation and other things will, scientific innovation and research is being ground to a halt. And we are lacking our public health infrastructure that it will allow us to respond to pandemics has been significantly weakened in this administration.
Thank you very much. Thank you, Mr. Chairman.
The gentleman